I thought we'd take a moment with the case study and use this simulation to connect a pulmonary condition to the ICF model and your clinical reasoning. So here's Bill. He's has severe COPD. And what I'd like you to do in this learning exercise is read through the case information and start to map information in the case narrative to the ICF model. So I have it for you here. And what you'll do is you'll read the information about Bill and see where that might connect to something within the model here. So for example, to get you started, Bill is a 62-year-old man. So according to the ICF model, personal factors in this case are that we're dealing with someone who is 62 and who is a man. So that's a way that you would map elements of the narrative to the domains within the ICF model. Go ahead and pause this recording now, take some time to do that, and then we'll move forward with a self-check. And I'll also introduce you to some web-based resources that you can go to try and familiarize yourself with how the ICF model is used in interprofessional clinical reasoning. Okay, so hopefully you're back and you have connected elements within this narrative to the ICF. So let's go down and check your understanding of what is going on with Bill with respect to this classification system. So what is the health condition? What are his involved body structures and function? Well, we know he has COPD. He's using steroid medications. We have some information about his vital signs and his gas exchange. We have some standardized test information about his breathing capacity, his lung capacity, his body shape, and then some information about how he presents and his medical history that involve structures and body functions that certainly influence our planning. So next, let's go to personal factors. These are information directly about the person. And in previous lectures, I've sometimes included the home situation with a personal factor. And so where this gets a little nuanced is a personal factor may be a habit, like patient prefers to live alone, patient adamant about living home alone independently. That would be a personal factor because it's an attitude or belief or habit. The fact that the family member lives with others, that the patient lives with others, is an environmental factor. So social supports are environmental factors, and we'll see this here. He lives with his wife and his son, and he gets help from his wife with some of his activities of daily living. So now that we've looked at those elements, let's see if we can really hone in on what are the focused activities and participation restrictions. We know Bill would like to garden. We know he'd like to lose some weight. We know that he needs help performing his activities of daily living. And there are specific activities that are called out here that are really challenging for Bill as a result of his COPD. So there's an example of how mapping to the ICF model starts to kind of help you consider some planning for your interventions. Your next step in this active learning process is to self-assess. How did you do when you went to classify elements within the case to the ICF model? And then just reflect on how you think this will help guide your thinking when you're implementing the physical therapy plan of care. Next, what I'd like you to do is think, what exercises will you do or will you select? And I guess more correctly, what exercises and interventions, assuming they're all available in the plan of care, will you select to help Bill reach his goals, improve his activity, decrease his restrictions for participation? And then also consider this, given that he desaturates, his oxygen levels go down when he's walking, what will you consider that would potentially improve his activity and work within the scope of practice where we really are trying to teach strategies and use equipment that might help conserve energy? Then I want you to think about, what do you think the doctor might consider based upon the cardiopulmonary performance during the 6-minute walk test. And then finally, given the personal factors, environmental factors, and the medical history, what are you considering maybe a best practice as you approach working with Bill and his family and educating them on rehab principles? So give that a try. If you're willing to go through that and would like some feedback from peers and from me, post your responses in the Can You Help Me forum and I'll take a look at it. Before you go, I do want to share with you a tool that I researched and wanted to share with you as something that you might use in your learning about the ICF model. So there is a tool that you can do by clicking on this link. I have it open in another window, so I'm going to go there. And this is called the ICF browser. What I think is really neat about this tool is that it gives you an opportunity, if you open up these windows, to look at what are the types of things that qualify as a body structure and function, and then go a little deeper. So for example, if we look at our recent discussions in lab about orientation functions, you can see that when someone is disoriented to time, place, or person, that is a mental function that is classified under a body functions category within the ICF. So orientation is the impairment. It maps directly to mental functions and therefore body functions. So that's an example of how you might use the tool to check your reasoning process. Let's do one more just for good measure. So let's go ahead and open up environmental factors, because that can be a tricky one. And you can see here that all of these elements fit in as environmental factors. So let's take a look at attitudes. This wasn't in the case, but you can see that your own attitudes about peers and colleagues in the process may influence your behavior, or it may influence the behavior of the family members and patients in that process. Okay, so that gets a little complicated, but just to kind of see how that connects to environmental factor, because that can be confusing. Let's look at one more, support and relationships. So you can see when you're looking at environmental factors, these are all elements that would be considered environmental factors that may impact activity. Here's a great example. For example, let's say Bill has a pet, and that pet is a cat, and Bill has acquired a low-grade allergy to that cat. Can you see how the animal in Bill's family's life would potentially influence his activity, participation restrictions, and his health? So this is a nice tool. I have it linked in the Soft Chalk lecture. You'll notice it doesn't include personal factors because those are so variable, they're difficult to standardize. But this might be something that you can go back to as you're problem solving around your reasoning and trying to see how everything fits in clinical planning. Thank you.